Hello, this is Dr. Hizon, here to talk about the documentation as a informatician for a patient with abdominal pain. So abdominal pain, when you start to the history of the pheasant illness, you need to ask a lot of different questions. So abdominal pain is rather lengthy, and your provider may ask about the type of abdominal pain. Is it crampy? These are some of the adjectives: gassy, sharp, dull, bloaty, burning. Is it localized or is it all over? So those are some of the descriptive terms. And is it associated with reflux or heartburn, chest pain, palpitations, difficulty or pain with breathing? And they usually like to do the pain scale, 0 to 10, where 0 is no pain, 10 is the most pain they've ever had. Pain going to the back, or does it go to the shoulders? Is the pain worse with urinating or defecating or menses? Is there vomiting? Is there diarrhea? Is there bloody urine? Fevers, chills, appetite changes, headache, and or jaundice? So the causes of abdominal pain are many, and a lot of times they go by where in the abdomen they are. So if you look at the patient is looking at this is right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. So your provider will be trying to decide, is an organ inflamed, such as a gallbladder, pancreas, stomach, appendix, or liver? Are there hernias or adhesions? Are there bowel obstructions? Do they have some sort of diarrheal thing, gastroenteritis? Could it be secondary to food poisoning or other kinds of toxins? Could they have diabetes and be in what's called ketoacidosis, where they are out of control with their diabetes? Could they be in uremia from renal failure? Could they be going through withdrawals from some sort of drug addiction? Crohn's, ulcerative colitis, ischemic bowel ulcers, and then they get into diverticulitis, which is usually of the large intestines, mostly on the left lower quadrant. Could they have a malignancy? Could they have colon cancer? Could they have a kidney infection, a urinary tract infection? Could they be premenstrual syndrome? Could they have a pregnancy, either intrauterine or ectopic pregnancy? Could they have aortic aneurysm, back injury, pneumonia, heart attack? So the differential diagnosis of a patient with abdominal pain is quite lengthy. How do you diagnose this? We look at the type of pain, what are the associated symptoms. After the thorough history, we start to do tests, and then hopefully then come up with the diagnosis. Remember that they will always do vital signs, so it's important to remember that vital signs are vital and to record them appropriately. And then on the physical exam, they'll be looking for things such as guarding, rebound, or the bowel sounds being abnormal, either hyper acoustic, having hyper bowel sounds or lower bowel sounds. And then we may do testing such as a CAT scan, MRI. They might do an arteriogram, which is a test where they shoot dye up into the arteries. They'll obviously do blood tests. There may be stool studies, such as for blood, but also for infections, urinalysis, and then down the road they may do an esophagogastroduodenoscopy, which is an upper endoscopy. They could do a colonoscopy, and then finally they may do exploratory surgery. What's the treatment for abdominal pain? Well, in short, fix the problem. If the abdominal pain is a certain symptom, it may be an emergency. That's a surgical abdomen. If it's an infection, allow for replacement of fluids, allow for evacuation and nutrients, and maybe antibiotics. If there's no infection, sometimes we need to slow down the bowels if they have explosive diarrhea and things, or reduce the inflammation. Medicines that might be used are the following: Dramamine, Meclizine, Reglan, Zofran, Bentyl, Pepto-Bismol, Kaopectate, but then we may use things to cut down acids such as proton pump inhibitors, histamine 2 blockers, loperidine, which basically is something to cut down diarrhea, and kaopectate. So in summary, when you're scribing and or an informatician for abdominal pain, be careful to make sure that you get all the details down, as the differential diagnosis is very challenging, and it's going to be very important to document exactly what the provider asks for. And in summary, remember that informaticians save doctors while doctors try to save patients. Thank you.